Hi, this is Paul Palmer, and
This is Natasha Todorovic-Cowan.
how are you today,
Oh,
Natasha?
I'm good, but I'm confused. What is that behind you? You've got a don't run. Oh, and it's a guy running. And
Yeah,
what's on the other side?
and then the other ones, the sign that says "Do not use sharps," with, of course, a nice sharp pointed
An
thing underneath.
exacto.
With,
Oh, so so we're continuing a theme of breaking rules, huh?
yeah, yes.
You know, that reminds me, we've got a non-smoking ordinance in Santa Barbara, and you've got little non-smoking signs in all the stores. And inevitably, you've got a tourist, usually European, sitting under the non-smoking sign, smoking, or the homeless folks are smoking. It's like, why do people break the rules?
I don't know it when you go around on an audit in a manufacturing facility or sometimes a warehouse even, you look around and you see the coffee stain on the desk in the area where it says on the way in, no food, no drink. And they get trained every year. You can't go into the warehouse with food and drink. You cannot go into the manufacturing area in food and drink. And you see the little coffee stand, you think, yeah, what you been doing? Or you, well, the best one for me was, yeah, I can't remember if it was an FDA inspection or an MHRA, and they went into the manufacturing area, all spick and span, everything completely tidied up. They went to the rubbish bin, picked out a sweet wrapper, and you say, sweet wrapper in the bin in the manufacturing area. And you're a long way from the nearest place where you're allowed to eat. It's got
In their
citation.
pocket. Well, did you guys have the fake COVID masks in Europe? I mean, we had a whole bunch of those fake N95 masks. So I get the idea of the knockoffs and trying to take advantage of an opportunity,
Mm-hmm.
right? But again, that's not the following of certain standards. And somebody using that, expecting protection from the fake, could end up with COVID.
The quality of the masks here varies massively. The early on, I suppose, probably there was a lot rejected, so they were importing millions of them at once, and having to send them back. So the NHS, they need them for safety. They need them for the staff. They need them for probably for patients as well. I don't know. And they were bringing them in, and they were coming in without the filter in the middle. So they've got two layers, but they've not bothered putting the filtration in. Why have they not put it in? Because there was a shortage of the manufacturer of the filter. So they just shipped it anyway, defective, so they could get the money.
Wow. So do you think that's a purposeful ignoring of the rules, kind of like the guy knowing he's not supposed to run but running?
Mhm.
Or is that just that opportunistic look, it's chaos, we'll figure it out, we'll see if we get the money, at least we're doing something.
I think it's a case of we want the money, we don't care about anything else. We're in a commercial situation. They're going to pay us. Don't worry about it. Maybe they
So
won't notice.
it's not the don't break rules. It's really the not caring at all that the outcome is somehow a greater priority and more valuable than the downside.
Mhm. Yeah, and actually, it's a good point because one of the key things we talk about here in the UK and Europe in general is falsified medicines. And I know the track and trace system for medicines in America works slightly different to ours. So in America, you don't have the option to scan to a central database. You use a scanner, which then you have to refer back to the manufacturer instead. But the bit that concerns me is the number of companies, the number of people that are intentionally placing defective product on the market. And originally it was the lifestyle drugs, like Viagra, things that are not life-saving. But now they've moved on to the where they can make a big profit, proper treat even cancer drugs, anti-cancer drugs, and they're putting a falsified medicine on the market. Who does that? All
Yeah.
right, they're going for money, but have they got no even
Ethics.
empathy for anybody in the world?
Yeah.
No ethics, no nothing. They're just, yeah, got the money, I'm off.
Yeah. No concern, no set of ethics, no standards. Yeah, it is increasingly more and more important to look for these bad actors because the consequences of them in a global economy are even more profound than they were previously. And I mean, we see it everywhere. I mean, I see it in the policing of my own trademark. There are people flying the Spiral Dynamics flag and they've never done a training. They don't have the rights to use it. They don't have a license. Maybe they picked up and read a book, and people are buying it.
Yeah.
So it's in every industry, I think. And it is of concern.
I know it's in every industry. I've seen the data on the counterfeits that come into the country across the board, across every product. And if you're counterfeiting something and you've got the packaging slightly differently, and it's I don't know. Well, I suppose toys is just as bad. If it's kids' toys and you've not done it properly, they can bite something off and swallow it and still die.
Yeah.
I just
It,
okay.
it, yeah, it reflects on the brand, it reflects on the product, and there are also negative consequences to the folks who are buying one thing expecting another. And that's the importance of the branding, and that's the importance of knowing whether you do or don't have a fake. And people just need to do their homework more and more.
And I think it's getting harder to do due diligence because there are so many fakes around.
Yeah,
And
yeah,
I think
yeah,
the problem's now actually spotting the right one.
right. Yeah, I mean, with the Prada bag, maybe no big deal, but cancer drugs, big
Yeah,
deal. So we need to have a ethos of going back to what's right, of going to what's ethical, of caring about the consequences of our actions on others.
yeah. It makes me wonder if the current pandemic might make people think more about each other.
I wonder about that as well. And I think we see that in the mask wearing. I think in
Yeah,
the mask wearing, it's a statement about a few things. One is I care about the rules. Two is I care about myself. Three is I care about others.
yeah,
And those who are not wearing masks when they should are in a sense saying, I don't care about you. I'm going to do what I want to do. To hell with you.
yeah. That's actually a real strong message that's coming from the government here. Is wear your mask because of others, not because of yourself.
Mm.
Look after help the NHS, look after each other, protect yourself, protect each other. They've got a whole plethora of not that many really, but they've got a range of slogans that's promoting the same thing. Think about each other. If you don't want to wear the mask for yourself, think about your neighbour that's actually over 80 and they're at really high risk if you don't.
Yeah, we just lost an icon of our community to COVID.
Mm, yes, there's it's it's not a nice situation and people are dying.
Yeah.
My wife's working in the hospital where they are.
It's a scary situation. And, I mean, I love the premise of what are the rules that, are kind of silly and we don't really need to follow
Yeah,
versus those that we really need to uh, go outside of our natural habits and build new ones to follow those because they mean the difference between life and death.
yeah, yes. The GMP rules, the GDP rules that I promote all the time, it's because of that. It's simple, and people don't realize. And when I'm doing training, the emphasis is, well, if you don't do it right, somebody could die. So do it right.
Yeah. Take a little extra time to do it right.
It is. I think on that really depressing note, we should finish, Natasha.
Sobering note, Paul.
All right.
Aren't our conversations supposed to be up and happy?
Yeah, let's make sure next time is. Okay, so it's Paul Palmer and
Sorry, guys, Natasha Todorovic Cowan.
we'll talk to you again soon.